Stroke is a major cause of death throughout the world, particularly here in Vietnam. One of the main reasons why it is a major cause of death is because people don't get medical attention soon enough, either because they don't recognize that it is a stroke or because they try methods that are proven to not work. The brain needs a constant supply of oxygen and nutrients in order to function. And these oxygen and nutrients are supplied by a series of blood vessels throughout the brain. If anything interrupts this blood supply to the brain, it can cause problems almost immediately. And the longer this disruption is there, the greater the damage that is done. There are two main types of stroke. The more common one is caused by a blockage to a blood vessel in the brain. That blockage can be a blood clot or perhaps some fat deposits, but something has blocked a blood vessel which has stopped the blood supply to that section of the brain. The other type is a burst blood vessel within the brain that causes bleeding into the brain. This also interrupts the blood supply to that section of brain. The longer the bleed is there, or the longer the blockage is there, the greater the damage to the brain. Another type of stroke is called a TIA, or transient ischemic attack. That is sometimes known as a mini stroke. That is when usually a blood clot or something interrupts the blood supply to a section of the brain, which produces the same signs and symptoms as a stroke. However, they can resolve themselves. The clot either comes out the other side or in some way the problem is resolved, so the signs and symptoms go away. Even if somebody does have signs and symptoms of a stroke and they go away, which is a mini stroke, they still need medical attention because it can reoccur. Now, stroke is a medical emergency. It is time critical. When the blood supply to a section of brain is interrupted, the damage can start within about 3 to 4 minutes. The damage will become progressively worse over a period of hours. However, the damage, once it is there, is not reversible. It is essential that the victim goes to the correct hospital to get some treatment for it as soon as possible. The signs and symptoms of somebody having a stroke, they're not always the same because it depends on what section of the brain the interruption to the blood supply is. But often the more common signs and symptoms would be things like headache, particularly focused on one part of the head, weakness or numbness or tingling in the hands, the feet or the face, sudden blurred vision or difficulty speaking or understanding, difficulty swallowing. Sometimes you will notice that the veins on the neck become distended, they become bigger. There may be urinary incontinence or perhaps dizziness, loss of balance or a sudden unexplained fall, drowsiness, confusion or a reduced level of consciousness. All of these can be signs and symptoms of a stroke. How we determine if we suspect somebody is having a stroke or not, we use what is called the FAST test. And that is FAST, and the FAST stands for face, arms, speech and time. Management for a victim who's having a stroke is basically keep them comfortable until you can get to the hospital. Now, we need to put them in a position of comfort. Generally, they will find that position for themselves. If they wish to lay down, that's okay. However, it is advisable to not be laying down flat. Just in case it is a bleed into the brain, we don't want the victim to lay down flat. So if they do need to lay down, at least have the head elevated at least 10 degrees. So have the head elevated slightly. But find the victim in a position of comfort, transport them to hospital, and monitor their breathing at all times. Because if they stop breathing normally and become unresponsive, we will need to be doing CPR. There is no first aid treatment for stroke. Do not try any home remedies. Do not try traditional methods. Do not try medication. The victim needs to be in hospital to determine what sort of stroke it is. Then the medical treatment can proceed from there.